Welcome to Podocyte Talk. Starting this month, Podocyte Talk will be coming to you twice a month, bringing you concise, evidence-based updates on the latest in kidney disease research and treatment. And to make it more interactive, each episode will now feature 2 multiple-choice questions. Drop your answers in the comments and join the conversation. In this episode, we focus on 3 important studies that challenge long-standing practices in nephrology, ranging from managing hyperphosphatemia in dialysis to optimizing the timing of immunosuppression in membranous nephropathy, and finally addressing cancer risk in chronic kidney disease. We begin with a large network meta-analysis assessing the efficacy and safety of phosphate-lowering agents in over 15,000 dialysis patients. The study compared 11 different agents, including calcium-based binders, sevelamer, lanthanum, sucroferric oxyhydroxide, tenapanor, and others. Sevelamer was significantly associated with lower all-cause mortality compared to calcium-based agents. Furthermore, sucroferric oxyhydroxide and tenapanor ranked highest in improving survival outcomes, while lanthanum and sucroferric oxyhydroxide were linked to slower progression of coronary artery calcification. On the other hand, calcium-based binders were associated with higher serum calcium levels and lower parathyroid hormone levels, which may contribute to vascular calcification. Gastrointestinal side effects were more common with nicotinamide and sucroferric oxyhydroxide. These findings suggest that non-calcium-based agents not only improve survival, but may also offer cardiovascular protection, shifting the treatment paradigm in dialysis-related hyperphosphatemia. We then shift focus to a retrospective cohort study of 312 patients with autoimmune membranous nephropathy, followed over a median of 5 years. The study investigated the impact of delaying immunosuppression in patients who eventually required treatment. The results showed that for each year of delay, patients experienced an average eGFR loss of 7.7 milliliters per min per 1.73 meters squared. While many low-risk patients achieved spontaneous remission with minimal risk of kidney failure, those in higher risk categories had much lower remission rates and a significantly greater likelihood of progressing to end-stage kidney disease. Notably, the best predictor of progression was the eGFR at the time treatment began, not at diagnosis, highlighting the harm of prolonged watchful waiting in patients with worsening function. Finally, we explore an often overlooked aspect of chronic kidney disease: the risk of cancer in patients not yet on dialysis. In a systematic review and meta-analysis involving more than 5.5 million individuals with CKD, researchers assessed whether reduced kidney function is associated with increased cancer incidence. The analysis found that people with an eGFR below 60 milliliters per min per 1.73 meters squared had a significantly higher cancer incidence than those with preserved kidney function. Specifically, the incidence rate ratio comparing CKD patients to those with normal eGFR was 1.35, and the risk increased further with more advanced CKD stages. While the data did not strongly link CKD to specific cancer types, the findings suggest that CKD may independently raise overall cancer risk, particularly as patients age. These insights support a growing call for tailored cancer screening strategies in individuals living with CKD. Join us on Podocyte Talk as we continue to bring you the latest insights into kidney disease research and treatment. Check the description for links to the studies discussed in this episode, and stay tuned for more insights into kidney disease research and clinical innovations. Tune in now to stay informed.